Hi, it's Ross Miller again on a presentation on understanding SoundBite and its relationship to dentistry. Let's first look at ideal fitting ITMs and parts of the ITM, the part that goes in the mouth. What you see here is an actuator. The actuator is what imparts the sound to the teeth, and you'll see it fits a certain way onto the teeth. There's a little M&M-like nub on it that has to always touch two teeth, as you see here. It can't be too high or too low on the teeth. We don't want it interfering with the gums. We want it to fit nice and tight on two abutment teeth for the SoundBite system. The wire that you see has to fit behind the most distal tooth, and that's 061 wire. What you see here is the battery of the ITM. It needs room to fit on the palate. We'd like to see it down low on the palate, but we can also raise it up a little bit on the palatal surfaces of the teeth. And it needs to fit behind here. Here's the actuator again being brought in. Ideally, it fits on two teeth, which could be a first and second molar, also a second and third molar. But we don't want it rotated, and you can see that we are very much dependent on the anatomy of the teeth, missing teeth, or restorations that are on the teeth. We can always bring the actuator forward, but sometimes it can be an aesthetic problem. Here's the battery being placed with the models together, and you can see again how much space we need for that wire. Here's a nice fitting ITM on a model, and it fits nicely. It should be out of occlusion, but again, it's very much dependent on the patient. Now let's look on the models. Here we see a couple of ITMs that fit very nicely on some dental models that they're made from. Again, that actuator nub needs to fit on two teeth, otherwise the sound quality might be compromised. Here you see the ITM on a model. This is sort of our standard display model. Now let's talk about bridges for a moment. Bridges offer a number of challenges for a SoundBite, in that especially if we're trying to place the actuator on the pontic. Pontics have been shown to be a little bit challenging. Here's a 4-unit bridge, and I'm going to put the actuator up against that. And the problem is occasionally the actuator will slide up under the pontic, and thus not imparting the sound directly into the teeth, but actually imparting it into the gingiva. So you need to really look at the contours of the bridge, and especially these long span bridges. We believe that the SoundBite system will work fine on bridges if the contours are correct. It's not a matter of the bridge or anything related to the material, but on a 4-unit bridge, sometimes you have high-end dry pontics, sometimes you have under or over contoured pontics, and we are very much dependent on the anatomy of those of the pontics there. Just a quick comment about this cast that you see here. Well, we do quadrant impressions, but we do need to get all the way to the midline, and the reason for that is we want that battery to be comfortable, and we need all the palatal information we can get in order to make that happen. Let's take a look at another bridge, or actually a case that is quite interesting in that on one side we're missing teeth, and the other side we have a bridge that is not perfectly contoured. So the bridge is all we can put it on. We can't put it on a edentulous area. Here's another bridge that looks fairly well contoured, but on the other side we have natural teeth. So we always want to be on the natural teeth if there's a choice. And if there's a choice between implants and bridges, we would much rather be on implants because we don't have that separation between the pontic and the bridge. On this patient, this doc had a question of implants versus bridges. And we can always move that actuator forward. It's may interfere with speech a little bit. Patients need to be. It's really important that you talk to your patients about whether if you put an implant in or bridge and the effects on the ITM. So coaching, when you're doing extensive restorations, coaching is critical to having a patient that's happy with SoundBite. So you need, again, two teeth. This actuator touches two teeth, on either side of the nub. This patient had a very small upper left second bicuspid that did not allow the actuator to fit, and then the other side possible implant. The solutions here is a crown on that upper second bicuspid or an implant in order for SoundBite to work. Now let's talk about palatal tori. Tori offer a few challenges that other parts of the anatomy don't. Namely, it's a big piece of bone up on the roof of the mouth that interferes with the battery. Notice here on this cast, the battery barely fits on that cast. Here's a very large tori in which we would never be able to get the battery to fit there. And then there's also a very small tori like this one, so that tori would not interfere with it. And here's a ITM butted up against a tori. So one solution on this particular patient is that they had their tori removed. Removing a tori is a good solution for some patients, but maybe not all. And on some patients, we're simply not going to be able to put the battery up on the roof of the mouth. Here's a patient with a very large exostosis, and you can see what effect that might have on the battery. Now, we may be able to work around it, and we may not. So tori and exostosis can be a problem. Let's talk about short clinical crowns. Short clinical crowns interfere with the retention of our device. We require the lingual side to be, we get retention from there. And if the crowns are very short, potentially the patient might have occlusal issues where they hit the device, or simply it's very loose. So watch out for short clinical crowns. Third molars don't seem to be an issue for SoundBite. We can work around those depending on if they're erupted, fully erupted, or and in good alignment. So third molars in good alignment, fully erupted, are great. Super erupted teeth are a challenge in that, again, like we said earlier, you want the actuator to touch two teeth in the exact spot. And here there's really no way of defining where that place will be. Choosing the opposite side is a solution for a super erupted tooth. Look for the side without a problem. Gingival margins on crowns can also be an issue in that the actuator will move up into the gingiva if the crowns are poorly contoured up toward the gingiva and potentially cause a little blunting of the papilla. So watch out for over-contoured crowns and margins way up high. Caries should be detected before we take in a model, before we get the model in-house here at Sonitus, because in this case, this patient had a cavity on tooth number 15. You can see it's quite large, and we wonder if there's cavities on the other side. So please treat that before taking the impression. So in summary, identify potential problem areas before the impression. Understand the SoundBite design. Again, this is an FDA-approved design, and we don't vary from it. We're not making different shapes and sizes. The battery is the same size it always is, and so is the actuator. Tori might interfere with battery placement. They may need to be removed if they're very large. All caries should be taken care of before the impression. Left versus right decisions have to be made. If you feel that if you have a bridge on one side, the other side would probably be better. Implants are a better option than bridges, all things being equal. The farther anatomy and dentistry is from ideal, the more potential problems you might have. You ideally want the ITM, the oral part of the SoundBite, to have a healthy platform with a minimum 3-year lifespan of the dentistry on the abutment teeth. You don't want to put the ITM, deliver SoundBite, and then a week later decide to put a crown in. Thanks again for watching, and have a great week.